Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. This is another cardiology update. The feature presentation is myocarditis or inflammation of the heart muscle in patients with COVID infection or those who had received COVID vaccination. In this presentation, we're going to answer three basic questions. The first one is, how prevalent is myocarditis or inflammation of the heart muscle in the general population? We are talking about before COVID pandemic started. How prevalent is the myocarditis in the COVID population after the pandemic started? Next, we're going to talk about, does COVID vaccine cause myocarditis? So these are very important and relevant topics because it affects a younger population, and hence let us begin with the feature presentation. The CDC reported that the incidence of COVID infection related myocarditis is 16 times higher in the COVID infected population compared to those people who did not have COVID infection. So that's a very important point to keep in mind. Generally speaking, the COVID-induced myocarditis or inflammation of the heart muscle, which presents with chest pain and maybe palpitations and shortness of breath, was generally seen in the age group between 20 years and 30 years. When they looked at the data before COVID, that is like 2019, and in the year 2020 when the COVID was rampant all across the country, they found out there were 3,205 cases who were admitted to the hospital with history of myocarditis. These are random myocarditis cases. Whereas in 2020, the number of myocarditis admissions went up to 4,560. So there was a 42.3% increase in the number of cases of myocarditis in 2020 compared to those in the year 2019. Okay, let's talk about some of the facts related to COVID vaccine-induced myocarditis. You don't think the COVID vaccine should be causing myocarditis. I mean, you're giving COVID vaccine to prevent COVID infection and hopefully prevent COVID-related myocarditis. In fact, people who have received COVID vaccine have lower incidence of COVID infection and hence lower incidence of myocarditis. But nonetheless, vaccine itself can trigger the development of myocarditis or inflammation of the heart muscle. And myocarditis has been noted in patients who had received smallpox vaccine, like 2 days after they received the vaccine. So it is not the first time that a population is getting myocarditis following the administration of any type of vaccine for that matter. Let's talk about some of the facts regarding the COVID vaccine-related myocarditis, which is recorded in the Vaccine Adverse Event Reporting System, or VAERS. And in this database, most of the people had received a vaccine between December 2020 to August 2021, that is during the peak of the COVID pandemic here in the United States. They identified 1,991 reported cases of myocarditis occurring between 2 to 7 days after the administration of the second dose of the vaccine. And this is among a population of more than 192 million people who had received a total 354 million doses of messenger RNA-based COVID vaccine during December 2020 and August 2021. So the incidence is small, but nonetheless it does occur. Let's talk about some of the data related to COVID vaccine-induced myocarditis. 82% of the vaccine-related myocarditis occurred after the second dose. 73% was seen in people who were younger than 30 years old. 33% occurred in younger than 18 years old, and 82% of them were men. How did these people present? What was their prognosis? Well, most of these patients presented, of course, with chest pain. Some of them had palpitations and some of them had shortness of breath. They were all noted to have elevated cardiac enzymes, suggesting damage to the myocardium. The symptoms were treated with pain medications, anti-inflammatory agents. Majority of them recovered. This is in contrast to viral myocarditis we see. You get a flu-like symptoms, and a week, 2 weeks, 3 weeks later, you get some chest pain. Later on, you have some EKG changes, some elevated blood tests, and that's the usual presentation of patients with virus-related myocarditis occurring after a flu or influenza. However, in patients with COVID-related, vaccine-related, it usually occurs within the few days after receiving the vaccine, and it is generally self-limiting. However, let's keep in mind that we still need long-term data, because if you look at patients who have viral myocarditis, 6% of them go on to develop congestive heart failure and may need cardiac transplantation. So it's only a matter of time before we learn more about vaccine-induced and the virus-induced myocarditis and how they present themselves 5 years, 10 years, 20 years after the exposure to the virus or the vaccine. So ladies and gentlemen, this is a quick synopsis of how prevalent is the viral myocarditis in the general population, how prevalent is it in the people who had COVID infection compared to those who did not have COVID infection during the COVID era, and how prevalent it was in the vaccinated people, and how they present and what is their at least short-term prognosis. We have numerous videos on cardiology topics, more than 200 of them. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next video. I am Dr. NIK NIKAM, a cardiologist from Houston, Texas.